Thank you. Are you ready?
Yes. Okay. So the article I read was The Immediate Effects of Immersive Biofeedback on Gait in Children with Cerebral Palsy. And then a little introduction. As gait deviations are frequently observed in patients with CP, the study aims to investigate gait parameters that may contribute to improving functional gait capacity as there is no established protocol for gait training and CP. Step length is a frequently observed limitation which contributes to diminished knee extension, and poor ankle power greatly contributes to the step length. So in all, the relationship between those three parameters will be beneficial to further assess together and individually. Repetition, which can often become boring, can be beneficial to restructuring motor pathways in patients with spastic paresis. Thus, this study also aims to assess if visualizing biofeedback via immersive reality is an effective form of biofeedback to counter the boringness of repetition that sometimes follows. The objective is to explore the extent of adaptability of gait in children with CP by providing immediate biofeedback of step length, knee extension and late swing, and ankle power generation from mid-stance to toe-off. In addition, to further assess the optimization of biofeedback visualization, additional trials compared the effect of biofeedback with an avatar compared to a simplified representation. And the methodology is the study design is a repeated measures, and the gait was assessed via a 10 camera 3D motion capture system with 26 retroflective markers placed on anatomical landmarks using the human body model software. There was 22 participants, and the criteria were that they were between the ages of 5 to 16, had the diagnosis of spastic paresis, unilateral or bilateral, and on the gross motor classification system that they were a 1 or 2 and did not require the use of assistive aids. Participants walked for 6 minutes on the treadmill with a safety harness at their selected comfortable walking speed to establish a stable gait. And then before starting the trials, participants walked for 1 minute to establish baseline parameters to then set patient-specific targets. So the participants performed a series of trials in a randomized order lasting 2 minutes, and the different series were A, avatar only without any biofeedback, B, knee extension, which was visualized with a ball on a bar moving up and down, and as the ball during the swing phase, and as the ball moved up, it would move towards the goal green shade. And then C, that they were provided color-coded biofeedback via the avatar of knee extension during swing phase. D, provided color-coded feedback with the avatar of step length with the task of stepping on the blocks to make them turn green. And E, provided color-coded feedback via the avatar of ankle power with the task of increasing the power bar as they stepped. And then here is a visual of what it looked like in the atmosphere, where they had the big screen showing what they were doing, the avatar, and that one is the step length goal. The green boxes mean that they reached the goal, and then red is the next step that they're trying to accomplish. And here's them on the harness, the retroflective gear, and the treadmill. And then also on top of the series that they performed, following the trials on a 1 to 5 ordinal scale, the participants were asked if they, 1, understood the task, or 2, could accomplish the task. And the participants were also asked if they preferred the biofeedback of knee extension visualized by a bar or an avatar. And here are the results. The avatar-only visualization had small yet significant effects on gait, which showed they had an increase in hip abduction during swing, increased maximal hip extension, increased hip and knee range of motion, an increased knee extension in stance phase and initial contact, and increased step length. And then the effects of step length biofeedback, they had an increased length of 12.7%, wider step width, hip and knee range of motion increased hip abduction during swing, and increased ankle power by 19.7%. And then the effects of knee extension biofeedback using the avatar and the simple bar during late swing. showed an increase in knee extension by about 7.4 degrees around initial contact. Knee extension during stance phase increased, and knee range of motion increased, and step length increased by 19.2%. And then when they were asked if they preferred the Avatar or the Simple Bar, participants said that they preferred the Avatar versus the Simple Bar. And then next, the effects of ankle power biofeedback resulted in an increased ankle power by 37.3%, increased peak hip power during push-off, increased knee flexion and swing, increased peak knee extension and stands, increased knee range of motion, and increased hip abduction during swing. And then it was observed that peak activation occurred earlier in the gait cycle than during baseline, and participants were asked if they understood this task or if it was too difficult, and it resulted in the least understanding, which can also be seen here on the little surveys. As you can see, the step length with Avatar was the easiest to complete and most understanding, the easiest to understand, versus the ankle power with Avatar was a lot harder to understand for the children and had a harder time at completing the task. And then discussion, although the sagittal kinematics showed improvements in step length, knee extension, and ankle power, overall gait performance measured by the gait profile score did not show significant improvement or worsening. Compensational effects due to biofeedback resulted in increased hip abduction during swing and step width, which to possibly increase the stability during acute learning. In conclusion, immersive reality demonstrates that immediately visualized biofeedback can result in clinical improvements in step length, knee extension during late swing, and ankle power during toe off, thus suggesting that biofeedback-based training is effective in improving short-term walking function. Also, participants preferred the visualization of biofeedback with an Avatar versus a Simple Bar. And then a few limitations is due to the immediate response to the biofeedback tested, the long-term adaptability of gait in children is unknown. Also, refined control is not possible in 2 minutes, and it is not predicted that any gait improvements will persist following cessation of the biofeedback. Improvements also could have been a result from the first stage of cognitive learning. Therefore, further long-term training is essential in establishing if gait adaptations can progress to the autonomous phase and motor learning. And the outcomes should also include measures of gait in the context of activities and participation, such as energy expenditure, walking speed, and endurance, to be able to establish if immersive biofeedback can improve function with everyday activities. And then any questions?
It's good. Thank you, Yvette, for your presentation.